Breast cancer is very curable these days, especially if the cancer is detected early. As a scientist at the FDA, one of our charges is regulatory science. So we're focused on how to evaluate the performance of different breast imaging technologies. So one of the ways that we do that is we develop breast phantoms. And so our phantom is essentially a stack of paper, but when you image it, it looks remarkably like a real mammogram. It can be used for testing lots of different aspects of a mammography machine. So in the end, we have some statistics. We want to assure that mammography systems that are in clinics around the United States are giving their best performance so that cancers won't be missed and unnecessary biopsies are not conducted.